Have you ever gotten one of those phone calls that you'll just never forget? Specifically, a call from a family member or a loved one in distress? Well, I'll never forget the day that I got an emotional call from my mom in December 2017. It was late in the evening, it was dark outside, the phone rang, and when I answered, my mom was in tears. Because outside of our little home in Cleveland, Ohio, in her very own driveway, my mom had been held up at gunpoint in an armed robbery. Understandably, my mom was emotional. She was terrified. In fact, I was terrified because I was worried that something terrible had happened to someone I love. Because that's what we do in those moments, right? Our minds start to wander and think about worst case scenarios. And in that moment, all I wanted to do was to be able to console my mom and to fix things. But I was confused and I didn't know what I could do. I was just a graduate student at the time. Little did I know, though, that moment would greatly impact my career. Good evening. My name's Evan Goldstein, and it's an honor to be speaking with you. Today, I come to you as a son, a father, a gun owner, and a professor who researches firearm violence and suicide, focusing on populations that are historically underserved and underrepresented in our society and our science. Now, as a son, a father, and a gun owner, I'm deeply concerned. I'm deeply concerned because most firearm deaths in our country and our state are suicides, not homicides where guns are used against other people. I'm deeply concerned because most suicide deaths in Utah and the United States involve firearms. And I'm deeply concerned because firearms are the most lethal method of suicide death, often preventing life-saving intervention from healthcare professionals and family members in the home when a crisis is occurring. Despite all that, though, as a researcher, I am motivated and I'm energized by my work and because of my work. My journey as a researcher began in New Orleans, Louisiana, where I studied economics and worked in a psychology laboratory as an undergraduate student. I then learned how to conduct statistical analyses and write research papers for the very first time at the University of Cambridge, where I was a Cambridge Trust Scholar. It wasn't until I moved back home to Ohio to train under my mentor, Tom Wickheiser, that I found my true passion, investigating how mental health, firearms, firearm violence, and health disparities affect and impact our communities. A student himself of a legendary researcher by the name of Avitas Donabedian, Tom Wickheiser motivated me and inspired me to work hard and to do research the right way. Tom also gave me my first opportunity to investigate the public health and policy consequences of firearm violence and suicide, which again accounts for most suicide deaths in our state. Those experiences and other experiences at organizations like the RAND Corporation, a large global public policy think tank, prepared me well for my academic job search, and in 2021, I seized the opportunity to join the incredible faculty in the Department of Population Health Sciences at the University of Utah through the Transformative Excellence Program in Health Policy and Health Economics. And I was so excited to move to Utah, a vibrant and healthy state, but a state facing a conundrum, which is that Utah is located in what is often referred to as the American Suicide Belt and the American Gun Belt. It's a place where suicide rates outpace the national average and where, frankly, there are more firearms often than families. Those are experiences. Those are opportunities, rather. And I was so to join the faculty at the University of Utah because here I have the resources I need. And here I have access to brilliant collaborators, things that I need to be able to do research that has the potential to actually do something about the population health problems that I care about and that keep me up at night. The type of resources I didn't have when I was that scared, confused graduate student taking my mom's call in 2017. Specifically, firearm-related suicide deaths are on the rise among women and in communities of color in our state and nationally, but there's little systematic knowledge about why or what to do about it to help save lives across these populations. Now, my research aims to fill some of these gaps in our knowledge, and I'm excited to talk about two of my projects with you today. The first project was funded by the National Collaborative on Gun Violence Research. Through this work, my colleagues and I leveraged tools from artificial intelligence, or AI, to answer a specific question, which is what happens to women who die by firearm suicide? Or what are the specific circumstances that occur prior to their deaths? Notably, suicide death is not just a mental health issue. Combined with easy access to highly lethal tools or methods like firearms in the home, there are often co-occurring mental, emotional, physical, and even social circumstances that affect one's ability or capability, in the theory, of one taking their own life. But again, there's little systematic knowledge about what those specific circumstances are or how to identify and predict those circumstances among women who die by firearm suicide specifically. So through this work, we use tools from artificial intelligence that enable computers to learn from, understand, and interpret human language, and specifically human language in text in this context. We use these tools to comb through thousands of coroner and medical examiner reports of women who died by firearm suicide, much like the one shown here, and then accurately and efficiently identify and predict when important circumstances were occurring prior to their deaths. And this work led to important new insights, such as many women who die by firearm suicide experience physical pain, or even circumstances like sexual abuse or romantic relationship problems prior to their deaths, and not only mental ill health. Now, as you can see here, on a scale from 0 to 100, with 100% being the most accurate, you see that we are able to develop highly accurate models for identifying and predicting when these circumstances occurred prior to death. And ideally, these new insights will help inform and improve prevention opportunities for women in the future, such as informing when or under which circumstances an intervention like firearm safety assessment and counseling should be or could be provided to women across different clinical settings. Additionally, I was awarded a Career Development Award from the National Institutes of Health in late 2023 to study firearm suicide death among Black adults in the United States. Now, this grant is especially meaningful for what it represents. And by that I mean, for decades, there was effectively a moratorium on federal funding for firearm injury and mortality prevention research in our country. So that means effectively little to no federal research funding for this pretty important public health problem. But that moratorium ended in 2020. And this grant, my Career Development Award, represents among the first or one of the first grants since funded by the NIH to specifically investigate firearm injury and death in our country. Scientifically, the aims of this research are to investigate the life circumstances that occur prior to firearm suicide deaths among Black adults across the United States, and also to gather feedback from community members and healthcare professionals to better understand how healthcare systems, much like University of Utah Health, can help save lives and help prevent firearm suicide deaths in Black communities in the United States. Notably, this work is still in its infancy, but it's an important part of the foundation for my future research. Now, at this point of the talk, you may still be wondering about what happened to my mom on that dark December 2017 evening. Thankfully, my mom was okay. She was unharmed, but she had the resources she needed to ensure her safety. And in a way, truly, she was privileged. Which brings me to a final lesson that I'd like to share with you tonight, a final lesson that I've learned during my career. Before I was a professor and before I did research, I also served in various roles, from community health worker to community health center administrator, in communities experiencing some of the worst health disparities, especially mental health disparities, and highest violent crime rates in Ohio. And while my mom had the resources and social circumstances she needed to overcome her encounter with violence that night, often the community members I served professionally at the time were not as fortunate, and they weren't as privileged. Those lessons about inequity and privilege and suffering have stuck with me throughout my career, and today, and looking ahead to the future, I am motivated because my research specifically aims to better understand firearm violence and suicide in populations that are traditionally underserved in our science and our society, and most importantly, I'm motivated because my research lays the foundation for saving lives. Thank you for your time today.